Good afternoon, and welcome to today's Side by Side with the Division of Mental Health, Developmental Disabilities, and Substance Use Services, Improving Our System Together monthly webinar. Before we get started, here are a few reminders about the webinar technology. Please make sure you're using a computer or smartphone connected to the internet and the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call. Questions can be submitted anytime during the presentation using the Q&A feature located on your control panel. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Danette Steelman-Bridges and Susan King-Lanier. For closed captioning options, select the closed caption feature located on your dashboard. To adjust your video layout and screen view, select the View feature located in the top right-hand corner of your screen and choose the view that works best for you. Our focus today is strengthening North Carolina's MHSU IDD TBI workforce, innovations in recruitment, training, and retention. This will be followed by a panel discussion. At this time, I would like to turn it over to Kelly Crosby, Director of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Thank you so much, Dina. Hello, everyone. This is Kelly Crosby here. And as Dina said, I'm the director of this awesome division of mental health, developmental disabilities, substance use services, traumatic brain injury, and problem gambling. So that's me. Hello to those of you I've never met before, and welcome for those of you that regularly attend. So just want to thank everyone for being here today. I'm super excited about today's topic. But before we jump in, that's me, that's my bio. I've been at the department almost for 14 years, actually a little over 14. And I'm about to celebrate my 3rd year anniversary here as the division director. And I always tell folks it is the best job I ever had. I love this job. And that's because I love working with the team and I love working with the community. So I'm a licensed clinical social worker and I'm a person with lived experience. And so today, really excited to talk about workforce. We're specifically going to talk about some specific initiatives that we may have alluded to before, but we're going to break them down a little bit more. We are not going to spend a lot of time today talking about direct support professionals. We've had other webinars where we talked about our strategies to increase and strengthen and retain, to recruit and retain direct support professional workforce. That's really important for us when we're talking about supporting people with intellectual and developmental disabilities and traumatic brain injuries. We have a whole direct support professional workforce plan that we have been working on. We share routine updates about that plan through our Inclusion Connects, our quarterly reports that we post online through our Inclusion Connects newsletter, and we often feature that on Side by Side. So just want folks to know that direct support professionals are incredibly important to us, but you won't hear us talk a lot about that work today, but that is because we've covered it in other settings. And today we've got some new and equally important things to talk about. So if we could go to the next slide. I am going to talk about this with a particular focus on our licensed and unlicensed workforce. And when I talk about unlicensed workforce, primarily I'm going to be talking about, I'm not going to be talking about direct support professionals. I'm not going to be talking about certified peer support specialists. We talk about those a lot, super important in our system. But I'm really talking about really our qualified professionals, our associate professionals, and our paraprofessionals. And yes, QPs, APs, and PPs also support people with IDD and TBI. You'll see a lot of our slides are kind of heavy on the mental health and substance use side, but that's because the majority, but not all, please know that our IDD workforce are direct support professionals. But of course, anything we say today that talks about qualified professionals and licensed professionals also applies to supporting individuals with intellectual and developmental disabilities and traumatic brain injury. So I'm trying to emphasize that in case it's not clear enough on the slides today. Okay, next slide, please. So I'm going to remind folks about our strategic priorities, okay? So remember, we are required, and it's part of our privilege, to make sure that we have a state plan for our public mental health substance use and IDD system. We published that about a year ago. We are actually working on our first ever annual report to tell you about all these initiatives, the progress that we've made, to celebrate, to share data about the impact on the system, and then kind of tee us up for next year. But we're still focused on our 7 key priorities. So increasing access to care, improving access to quality IDD and TBI services, preventing substance misuse and overdose, building the workforce, which is today, strengthening our crisis system, expanding services for individuals in the justice system, and amplifying recovery and community-based services. And that is really our recovery services and community-based services for individuals with the most complex of needs. Now, we've talked about all of these, as well as our projects, in side-by-sides and in other venues. Today, we're going to talk about building the workforce. So that's the next slide. So under building the workforce, we have some very specific goals. We're not going to talk about peers today, but remember that's one of our goals, strengthening the peer workforce. We're not going to talk about DSPs today. We have covered this in other webinars as a reminder. So the 2 things we're really going to focus on is increasing the number of licensed professionals serving in the public system right now. And then we're going to talk about how we can increase supports for our unlicensed providers. And we'll unpack that a little bit more, but just as a reminder, these are our goals. And these are the projects we've been working on, and some of these are finally coming to fruition. And we're very excited to share about how these are coming to fruition. But those were our goals, and it took a really long time for us to work with the field, to work with providers, to work with consumers and families, to work with professional associations, to work with LME MCOs, to work with our sister agencies across the division like Medicaid, of course, to try to understand the conundrum of getting enough licensed providers to come into the public system, as well as what we could do to modernize and freshen our current system of having unlicensed professionals, what we call in North Carolina QPs, APs, and PPs, to provide treatment services in North Carolina. And it's a very unique North Carolina system. So next slide. So I'm going to go through the initiatives overall, and then I am going to actually have our panel who are experts in these 3 particular initiatives we're talking about today, and they're going to be able to drill down and answer some questions. But I think y'all know we have a workforce shortage. I don't think I need to make the case for you all about why we have to work on workforce. But I will say this, and I say this everywhere. I had the privilege of presenting on our workforce strategies actually 2 weeks ago at a big national policy summit in California. Folks were interested in hearing about how we were tackling workforce shortages here in North Carolina. So we know what the data tells us. Most of our counties really have incredible workforce shortages, and that's across mental health, substance use, IDD, and TBI. We know that. Next slide, please. So the first thing I'm going to talk about is, oh no, these are all 3 things I'm going to talk about today, right? Sorry, I'm still laying it out. So the first thing we're going to talk about is our new qualified professional initiative. So that one has its own set of slides. We'll probably talk about that one the most actually, because that is really modernizing a workforce strategy that we put into place over a decade ago. We haven't actually modernized it in a really long time, so it's time for that conversation. We're going to talk about a new pipeline to put more social workers and other licensed mental health and substance use professionals into our public system, recruit them, train them, and retain them. And a big part of that is actually a very new and special loan forgiveness program for those licensed professionals that I mentioned. And we're going to talk about how all 3 of these actually go together. It's actually, it is a pipeline. This is a 3-part framework. We want each of them to kind of build onto the next one. Next slide, please. So let's talk about the Qualified Professional Initiative. Next slide. Next slide's a little bit of a busy slide. And this one's important because a lot of folks who have kind of grown up in this field may remember how we came about to have our own qualified professional standards here in North Carolina years ago. And other people wouldn't know that, right? Because you might be newish to the field or new to North Carolina. I remember when I moved to North Carolina in 2008, I was moving here from Texas, but prior to that, I had served as a mental health licensed professional in New Jersey and in Pennsylvania, or New Jersey and Pennsylvania, and Texas then, of course. So when I was looking for jobs here, there were a lot of advertisements for things called qualified professionals, and I'd never heard of that before. So I had to actually learn about North Carolina's very unique law. Many of you know that you can be a qualified professional, an associate professional, or a paraprofessional with the right educational experience, educational credentials, and experience. Of course, you can also have a license. That's one of the ways you can become a qualified professional, AP or PP. But in many cases, you can have a bachelor's degree, a master's degree. In some cases, you can have a lower than that, a high school diploma, depending on the level of entry into the field. But today we're going to focus a lot on the qualified professionals, right? So right now in North Carolina state statute, there are required degrees. You can have human service degrees and years of experience in order to be a qualified professional in our field. And remember, we are doing what we did over a decade ago was recognizing that we had a workforce shortage. And so what North Carolina did was try to develop standards, right? Actual standards for whom could or who could actually provide services and supplement the services of licensed professionals, because we didn't have enough licensed professionals to provide services in the workforce. And I tell you, literally, someone coming here in 2008, I hadn't actually experienced that before. We had primarily licensed professionals, licensed physicians, of course. We did have peer support specialists. And in some cases, like especially in hospital settings, we had people who were certified mental health technicians. That was actually a certification program in the states that I practiced. So coming here was something new to learn. And again, it was a workforce solution that we used. I would say, and I can't give you real facts on this, the vast majority of our treatment is provided by unlicensed professionals here in North Carolina. And I'm talking about mental health and substance use. Typically, it is provided in the context of team-based care, right? I know we don't have qualified professionals doing individual therapy and billing for it. It's typically a team-based service like ACT, intensive in-home, community support team, and that's a team-based service. Typically has a team leader. It has a clinician somewhere. They're guiding clinical services on the team. It may have also guidance from a psych nurse or a psychiatrist, or at least ancillary support from one of those. So we provide a lot of team-based care in North Carolina. And so now is a moment. Now is a moment to look at those workforce requirements. And you may say, well, that's a funny time to look at it when we have a workforce shortage. But our wonderful friends at the community college system presented us with a solution. And it's a solution that not only has a ready-made pool of individuals who could enter our mental health and substance use workforce, but I would argue that these individuals have, in many cases, more training in mental health, substance use, and IDD than many people coming out of school with four-year degrees and experience. I myself, I'm proud of my degree, y'all. I have a bachelor's degree in psychology. And I always describe folks, I look at my course curriculum and what that was. For 2 years, I received largely a liberal arts education, important things, right? Sociology, biology, English, writing, incredibly important things, right? A good liberal arts education. For the last 2 years of my degree, I focused more on my psychology courses. But that, of course, was a broad, general swath of psychology courses, everything from social psychology to developmental psychology to statistical methods, what we called psychopathology back in the day. So I got a really good overview of all the branches of psychology so I could decide, what I was interested in, what I wanted to go into. So, that is really great and really important education. But a lot of what I learned as a clinician, I learned by going to a master's degree program that was very practical and hands-on. So social work, you have to work 20 hours a week and go to school 20 hours a week. I had lots of supervision. And like any other licensed professional, when I came out of school with my associate degree, I then had 2 more years of supervision before I could even get fully licensed, which is good. good process, right, y'all? I feel like I was pretty well trained and heavily supervised to make sure that I was a really good clinician, and I only got better as I practiced over the years. So um, what um, what the what this new qualified professional initiative does is, I think it takes the sort of the best of, and in many cases, the most important part of the education, and lifts that up. Meaning, if we're going to have folks work in the mental health and substance use and IDD field, let's take that really 2 years of concentrated experience in either mental health, substance use, intellectual developmental disabilities, and focus on that. So our wonderful friends at the community college system have an associate degree in human services, where the curriculum focuses very intensely on exactly what I said: mental health, substance use, IDD, everything from diagnoses to interpersonal dynamics and skills like motivational interviewing. Just to use an example, active listening, really knowledge and skills that could equip a person to provide supportive services in our mental health, substance use, and IDD system. When our friends at the community college system began to talk with us about this degree and a bill they were putting forward, they were wonderful. They were very upfront, and they showed us the curriculum. And I personally was really impressed by the depth of the curriculum. And it's kind of exactly what you would want someone who's starting an entry-level career in the mental health, substance use, or IDD field to learn. So we were very excited when the law passed, the Community College Behavioral Health Workforce Enhancement Act. There it is, and there's a hot link to the session law that you'll find it in. And it does allow us to enroll these individuals with an associate degree in human service that have this 2 years of very intensive coursework to, with the requisite experience, become a qualified professional in our public system. It's offered in over 41 of the community colleges across the state. And we have a whole bunch of grads out there in it already. And we think this is the first part of our pipeline. Can you imagine a system where when young people are in high school, they say, hey, I can actually go get my associate's degree or my certification as a mental health specialist, as a substance use specialist, as an IDD specialist, and I can have an associate degree where I get good concentrated education in that subject, and then I can get a job. I can actually get a job. I can get some practical experience and I can get a job. I think that's a real opportunity for us here in North Carolina. I can't tell you how many young people I've talked to that are in high school, and when you ask them what they want to do, they'll tell you, I'm going to be a certified medical assistant. I'm going to be a certified nurse's aide, right? There are associate's degree that meet their needs already, but there's nothing specific to, I'm going to be a mental health specialist. I'm going to be a substance use specialist. And I think this is a real opportunity for us in North Carolina to leverage this very intensive course that our community college friends already have. If you can't tell, I'm rather enamored of this. So, okay, next slide, please. So, can we do it? I cannot tell you how many emails, questions I get asked when I talk, phone calls, emails about when can we do this. First, I want to thank Betsy. I want to thank the Benchmarks folks. I want to thank all the legislators that passed this bill. It is in effect, but we are trying to work on its implementation right now, because what we want to do is make sure when U.S. providers hire qualified professionals who have associate's degree, that you're in compliance with policy. When you bill, there are no issues. When you're audited, there's no issues, et cetera. So what the team has been working on already, our Medicaid team and our policy people here at DMHTDS-US are working in tandem with our attorneys to look at our clinical coverage policies and our Medicaid state plan to make sure that we're aligned with the new law and if there are any changes we have to make, okay? We also have to make sure that there's a consistent implementation and auditing system, and that's through the LME-MCOs, the managed care organizations, and DHSR. So all we're trying to do right now is implement the law correctly, okay? So we're just trying to make sure there are no issues with clinical coverage policy, there are no issues with regular standards and audit practices, so you all can hire these associate level QPs and get them going. All right, next slide. So the next slide kind of repeats what I just said. This is what we're working on right now. We are working closely with the general counsel here at the department, our rules commission, right? Our rules commission, and our Medicaid policy teams to finalize the actual implementation of this guidance. We're very excited about it. So as soon as we make sure there are no issues, hiccups, we know everything we have to change or update in policy, state plan, and or regulatory guidance, we will give you the implementation steps and the timeline. I promise you, we are very eager to see this happen. I want to be able to say a year from now, we have 50 community colleges across the state offering an associate degree as a mental health specialist, a substance use specialist. And here's how you can get a paid internship to get your 2 years of experience. And oh, here's the new certification program, we're calling this. So people can recruit in high school to be a certified mental health specialist, substance use specialist, or IDD specialist. So we've actually created an entry-level job, an entry-level concentrated course of study to prepare folks for coming into the public workforce. All right, next slide. And I have to hurry, I'm low on time. So great, that's folks in entry-level unlicensed positions. We want to make sure they are in a degree knowing what they signed up for. They literally are coming out of high school or whatever. Maybe this is a second career, whatever it is, right? You want to be a mental health specialist. You want to work in the field. You want to be a substance use specialist, IDD specialist, fine. You can go get your associate degree. We'll help you get experience. And Betsy's going to talk about that a little bit later, how you actually get experience. And then you can get employed in our system. Okay. So the next thing is our social work pipeline. Next slide. We announced this maybe a week or two ago, but we will actually have more fanfare when the program actually goes live in January. We have worked with our colleagues at UNC Chapel Hill and a 25 School of Social Work consortium across North Carolina. Look at that beautiful map, all those schools of social work across the state. And we have developed something called the Public Service Leadership Program. It is heavily funded for 5 years, so $10 million over 5 years. So this is what we're trying to do. We're trying to recruit North Carolinians to enter the field of social work and enter the field specifically to work in the public system. So they would actually know what an ACT team is, what CST is, what intensive in-home is, what an LME-MCO is, right? All the things that when I talk to random social workers, they're like, what is that? I never heard that before. I thought I just billed Blue Cross Blue Shield, right? So we're going to recruit them with, and also recruit them to work in the public system, right? So their education will actually be certainly well-rounded, wonderful social work education, right? Clinical social worker education. But it will also be education about working in the public sector and what those positions are. And then the last thing, there will be supports for those individuals. So we hear this a lot. We're mission driven. We wanted to come in the public system, but my goodness, it's hard. It's hard. The pay is not great. We've got to supervise a bunch of unlicensed folks. It's field-based work. It's actually really hard. So we want to make sure that then those social workers who come into the system are supported mentally, emotionally, and otherwise so they can be successful in their careers in the public system. One more slide, because this is going to be coupled with the loan repayment program. Okay, next slide. So the loan repayment program, it's not just for social workers, mind, but we have a new loan repayment program. Sarah will correct me. I think the website's actually up and running, but I don't know if I don't know if people have seen it yet or we've sent it out yet. But we will be posting on there the applications for loan forgiveness. It will apply to what the law calls licensed behavioral health providers. That's a list of them. Licensed clinical addiction specialists, mental health counselors, clinical social workers, marriage and family therapists, psychologists, psychology associates, psychological associates. We have $20 million from the General Assembly. And largely, this will involve, if you have one of those degrees and you commit to 3 years in the public system, you will be eligible for loan forgiveness. And it's pretty hefty loan forgiveness, y'all. So if you go to the last slide, this all goes together, all right? It's a pipeline. We're trying to make an entry-level actual certification program for people that want to go into the field. You get your associate's degree, your experience. And remember, the community college folks are on, they're going to tell us about the experiential part. Those folks absolutely will know about this social work public leadership program. so they can go to social work school if they want, if that's the next phase and they want to go to social work school. They want to get their bachelor's in social work. They want to get their master's in social work, right? And then on the end will be loan forgiveness. And there's no wrong level to stop at, right? If you're happy having your mental health associate degree, great. You want a bachelor's degree in social work, great. You want your master's degree, great. But the point is that this is a pipeline. It's all aligned. Our wonderful community college system is working with that social work school. They're working with high school. So it's this wonderful pipeline. We're going to talk about working with providers, right? Because you're the ones wanting to hire these folks. And you're going to want to give them apprenticeships or internships. And we'll talk about funding for that, right? So we're just trying to create systemically a way for people to be trained well to enter our public workforce and hopefully stay a little while. All right, next slide. So this is the best part, the part you've all been waiting for. Let me introduce folks. And as I introduce you, I'm going to have you turn your cameras on. So we've got the experts here today who are going to talk about the new qualified professional rule expansion. We are going to have folks talk about the that public leadership program, that social work public leadership program. And then folks who are going to talk about loan forgiveness. So who do we have first? I think Sarah is the first person on my slides. So you'll know Sarah Valide. There you are. Hey, Sarah. Sarah is our Chief Clinical Officer for Substance Use and our Justice Involved Services here at DMH DDS US. All right, next slide. We have Betsy Zook, who's a workforce analyst at the Center on the Workforce for Health. That's at UNC Sheps. And Betsy has a long and distinguished career at in the community college system and was instrumental in passing that new QP law. And now she is helping us to implement it, which is super, super exciting. And then on the next slide, we have Sarah Reeves. Many of you know Sarah Reeves Houston. She is the Assistant Dean for Workforce Development and the lead PI for Behavioral Health Springboard at the UNC School of Social Work. Many of you have worked with Sarah and her team over the years through Behavioral Health Springboard and the School of Social Work. So welcome, Sarah. And then our last wonderful panelist is Melissa Smith, who's the Senior Estate Director of Health Service Programs at the North Carolina Community College System. So welcome, Melissa. All right, welcome to our whole panel, and you'll see their bios here and you'll see all their slides. So I'm going to have the experts talk to you about the new programs, okay? All right. So first, I'm going to go to, I'm trying to pull in my questions, y'all. Okay. First, I'm going to go to whoever wants to jump in, Melissa, Betsy, whichever one. How would you describe the key changes of the new law introducing the associate degree program that you already have for a long time, but now is linked to our QP rules here in North Carolina?
Sure. I'll jump in on that one, Kelly. It's a simple rule change that gets us a chance to leverage what has been growing and building here in North Carolina in our community college systems. So the rule change is adding an associate in human services to the qualifying degree. So it doesn't replace any of the degrees in the definition. It just expands it. It doesn't change anything about the experience. It'll be 2 years of experience that an associate in human services can now be a qualified professional. But what's huge is we have this system across the state, a huge footprint, and this program it's not new. It's been here for several decades and continues to grow.
Thank you so much, Betsy. Melissa, anything you want to add to it?
Hey, and thank you all for having me today.
Yeah.
I'm the least knowledgeable of all y'all, but
Nonsense.
the passion that these faculty have and the folks that we have 41 of the 58 community colleges have social and human services that have adopted that curriculum, and they run that program of study. And they're just a big part of the communities and how they are making better lives for the citizens of those communities. So if not for the passion of all these different faculty working on all this, none of this would have happened. So I really commend all of them.
Thanks, Melissa. And Melissa, I want to thank you back because I say to my team, I say it all the time, but I'm going to say it here for everybody. So, you know, it's tricky when we say like, okay, here at Health and Human Services, we're worried about the workforce. And what do? We're not the, you know, we're not employers, so we can't hire a bunch of people. We're certainly not educators like our wonderful friends at the community college system, but we have a need. And so the cool thing is that we have developed this amazing relationship with the community college. So I think you guys are phenomenal. And so you've been very gracious. And I think you've offered us a tremendous solution using your skills and your knowledge, abilities, and your programs to help us fill a need here. So really appreciate that. So
It's you asking. So we just need people to
we
ask.
are better together, for real, for real.
Absolutely.
So Betsy, I'm gonna ask you the controversial question. All right, all right, you got this, right? I'll be honest with you. Like Betsy knows this, right? Okay, but when I told some people, oh yeah, we're gonna open up the staffing rules and we're gonna add associate degree folks as qualified professionals, you would, oh my gosh, Betsy, that horror and outrage, right?
Right.
And I understand why, right? Because people were very worried that because of workforce shortages, maybe we were making a decision that might have been rash, that might be resulting in people with less training than our current qualified professionals. What would you say to that, Betsy?
So I understand where that's coming from, because there's a myth or the assumption that an associate degree is just like half of a bachelor's degree. But what we're really talking about is an associate in applied science that's been designed for workforce. And when you drill down to the curriculum, I thought this before I was a professor running the program, but the courses in it exceed the number of credits in human services than we are hiring right now with our bachelor's in psychology programs. So the numbers of that. So a typical psychology bachelor's degree will have a whole bunch of general education. It will have a bunch of pre-electives, and then it will have its core major. And core major will be about 30, maybe a robust program will have 40 credits in that. And that's the baseline of the number of credits that are in this Associate of Applied Science. When you go down into what the actual courses are, they are in applied knowledge bases for doing the exact work that we do in our mental health, IDD, substance use field. They are courses in crisis intervention. They are courses in counseling interventions. They are additional courses in the helping skills. There's courses in case management. There's courses in ethics. So it's not just one side class. Each one gets the drill down with that. And on many occasions, these students then are continuing on in their bachelor's programs, and the faculty and professors from them are saying that our students are going into those programs ahead of where their bachelor students are. So there isn't a lesser, it's just a different design to be able to prepare the workforce.
Betsy, I like how you said that. It's a different design. I mean, I think it's almost like I'll use my words, not yours, please. It almost feels like the intent perhaps is different. You know, when I got my bachelor's in psychology, it was great, but I was there clearly to get a well-rounded liberal arts education. And I got a well-rounded smattering of everything in the psychology world. And I loved it, and it kind of helped me decide which of those I thought was the best to go into graduate school. But it was not really preparing me to have practical application of those skills.
Absolutely.
Even though it was a great degree there, Pitt. Don't pick on me there, Pitt. Talking to my friends here in Pennsylvania, but it wasn't quite, it was not preparing me exactly for that. So, okay. So can we talk, Melissa and Betsy, about practical skills? Because a lot of what we hear, and I think this makes perfect sense, right? We struggle sometimes people have there's lots of folks with human service degrees, bachelors right now, right, looking for jobs, but sometimes we struggle with the 2 years of experience. So how are you helping the folks who are getting this AAS degree get that practical experience? Or what are some things we could do with you or collaboratively to help people get practical experience?
Melissa, do you want to start off with that? And then I can talk more about what we're currently doing with the apprenticeships.
Absolutely. And this program wasn't created in a vacuum. And that's the
Mhm.
beauty of the community college system, is that we have our finger on the pulse, I think, of our K-12 partners, of our four-year school partners, plus our local mental health providers, and able to create what they need based on what our community has. I used to be a dean in the western part of the state, a health science dean. We had a very large hospital there that was a behavioral health hospital. And so one of the things that we need, or that is the challenge sometimes, is we need partners to help us to place these students. And
Mhm, mhm.
and it's like, I don't know what to do with them. And it's not just in behavioral health, it's in nursing, it's in imaging, all the allied health, is that sometimes people are uncomfortable working with students because they don't know how. But I think a quick orientation to, just like you said, to talk about all the different things. I've got it in front of me because it's so chock-a-block full, but that they have an introduction. They understand about counseling. They understand about ethics and confidentiality. We already have 288 classroom hours, 188 lab hours in human services, just in that we call it core. And then they're specializing in other hours to, so they know what they're talking about when they get there. They just need that extra opportunity. Another thing is, we also look at non-credit to credit transfers, and there's a lot of non-credit courses that students that are non-credit and credit are in the same classroom. These non-credit students just maybe be looking for a certification. Eventually, then they can have a pathway onto their degree. So very intentional planning. Applied science is just how it sounds. You know, we are creating applicable skills that students can get right into the workforce. And that was the problem, you know, that has been solved when the QP finally gets all running, is that they will have a way to do this. And they have work-based learning 160 hours, that these students are going to have a lot of hands-on work, not just in lab, but in practice. And I think that's going to be really important.
And I'm going to tag on to what Melissa's saying.
Please.
This is what I am so excited about. And providers can start partnering right now with their community colleges. This opens up something that we've not done in our industry before, and that's apprenticeships. And this gives the opportunity for a provider to partner with their community college. So go right to their local space and hire an apprentice. That apprentice can start billing in their immediate capacity. So as a direct support professional, as a paraprofessional, they also start attending their community college and complete their AAS degree in social and human services. At the end of their apprenticeship, they've now worked 2 years at that provider, billing in their scope and capacity. So they have their 2 years experience, and they've completed their qualifying degree. So when we have the rule change activated, then they'll be able to exit there as a QP. And that's not, you know, someone new the provider's now going to be hiring in for that role. That's someone they're able to build and grow right there through that each of those months and those stepping stones for capacity.
Thanks so much for that, Betsy. And I would have, I'm watching the Q&A as it's coming in. There's a lot of interest, a lot of questions. And one of the things too, I'll mention, I think I have a slide on the end that tells everyone about it. We're excited to announce these things, but we will be sharing more information. So your questions help. It helps us to know, oh yeah, we need to clarify this, or we need to explain this. So know that your questions will get answered, maybe not today, but it will help us build a really solid or add to our implementation plan into the guidance that we give to the field. So thank you for those. Okay, keep an eye on time. I'm going to switch over to the social work pipeline. So Sarah, I'm going to jump over to you. Okay. So here's one, just how did you all partner with 25 colleges and universities to build this pipeline? That's pretty, I tell people we got lucky, Sarah. You guys just came to us and we're like, what? You have a 25 school social, could you just tell folks more about that? Because that's extraordinary.
Absolutely. So thank you for having me this afternoon. About 2.5, going on 3 years ago, our dean was in conversation with some of the other social work program deans and chairs across the state, and they were having some conversation around this phenomenon that we were experiencing here with our campus around our students. In general, students were coming in, doing extremely well in the program, leaving the program and going straight into the private sector and completely bypassing public sector employment opportunities. And so we needed to have some conversation around why is that? And so we did a general kind of very brief initial assessment of our students, had some conversations with them around this particular process that was going on. And the number one thing that came out for them is that they just did not have an understanding as to what jobs were available, what areas, where they were located, and just the awareness in general was just not there. And so we took a step back and we said, as university folks, we do need to own that and have a part that we understand that we play in just communicating what they have as their availability. But we also said this is a great space for us to come together and figure out how we can tackle this, because it's not just a UNC campus thing, it's an ECU thing, it's an NC State thing, it's a Campbell thing. It doesn't really matter whether you're at a private university or a public university. We're all seeing this phenomenon. We are all part of the North Carolina community, and we are all seeing the impact that our graduates have on what we know as being the workforce shortage. And so we came together, partnered up across all of our campuses, both public and private. We invited our community college partners to come along and have this conversation to really look at how can we address this workforce shortage across our entire state. And so that's where this public service leadership program came from. It's really looking at how do we establish this pipeline. You've already noted going all the way back to our North Carolina high schools and bring our students and our residents up all the way through this master's level social work process, and how can we really enhance their awareness and understanding of what social work has to offer North Carolina and what social workers can really do.
Thanks, Sarah. And what are some areas in the public system that you'll have? As much as I want them all to come into the mental health and substance use field, I know there's a lot more in the public system we need. So what are some things you're going to focus on?
Absolutely. So we identify what we call 5 critical service domains. They're not really listed in any order of priority, so don't come after me. It's just the order that we have them listed on the paper. But the first is child and family services. We understand that our DSS partners are needing a lot of support around how to recruit individuals into child welfare and foster care and permanency planning and things like that. And so we're really focusing in on that because we know that that's a significant area of shortage. Second on the list is mental health, behavioral health, and substance use services. And those mental health, behavioral health, and substance use services include both children and adults. And so how do we make sure that we are enhancing and producing enough licensed practitioners who want to go into the public spaces, into our community-based environments, to really meet our populations and our communities that are exhibiting the most highest complex needs. And that is something that we are also going to be focusing on. Third on the list is adult aging and caregiving populations. We are actually working to really focus in on how to address our aging population. We understand that folks are living longer. They are experiencing a lot more challenges with the longer lifespan, but we also know that there are services that we can provide, and we need social workers who are specifically targeted and trained in in addressing that stage of life. Fourth on the list is our individuals with developmental disabilities, intellectual and developmental disabilities, and that includes both children and adults in that population as well, and also individuals in the IDD population who have co-occurring mental health, substance use, and other issues. So there's some overlap between these critical service domains. Last on the list, but certainly not least, is our services to justice-involved individuals, and that is the social workers who work with the populations as well as those who are recipients or people who were part of the justice community. We're looking at how do we create wraparound services for that particular populations of individuals as well.
I can't get off mute. I was thinking that is really, that is super exciting, Sarah. Thank you. So last question. So what are the next steps and how can schools, colleges, universities, the public, how can folks get involved?
Okay, so what we are working on right now is a massive employer needs assessment. We've done a lot of work with our students and with our faculty across all of the 25 universities to talk about what are the things that are needed in the curriculum, what are the gaps that exist in the curriculum, where you take this accredited social work program, you put it in the context of public social work, and there's some limitations in terms of what our graduates are able to do. And so what this program is going to do is fill those gaps so that we look at issues like co-occurring needs, if it's IDD and mental health, if it's you're in the child welfare system and you cross over into justice involved spaces. How do you navigate that within the context of our program, both the curricular program and this training and certificate program? We've had that conversation, like I said, with faculty. We've had it with university folks. We've had it with students. We need to have the same conversation with employers because they are going to be the individuals who will be taking our students, hiring them, and hopefully retaining them for this very much needed work. Once we get that information done, that will be used to inform the construction of our certificate programs. And we have 5 that we're developing, and they're at the pre-BSW level for high school students and community college students. We have a BSW level certificates, and then we have our MSW level certificates. And so we're going to use this data that we're collecting from our employers to really inform so that we make sure that what's being created is not done in a vacuum, like Melissa said. It's done with all of the right thought partners at the table so that we have a truly qualified product. We're in the midst of this planning year. Next year, we're going to be piloting the bookends of the program. So we're going to pilot our high school pipeline program, and we're going to pilot our MSW program, and then use that information to inform the middle. And that's pretty much where we are with it. But we have lots of opportunity. I think the companion slides have some links that can get you my contact information so that you can reach out and say, hey, I want to be a part of this initiative, whether it's serving on a committee, whether it's providing didactic and learning material and content for the various learning collaboratives that will come out of this. We want to know and we want to bring everyone to the table because there's plenty of space at our table for this program.
Thank you, Sarah. That all sounds absolutely marvelous. And as Sarah said, you can contact her. We'll also be working with Sarah and the whole UNC team and the Social Work Consortium to publish lots of material and information as the program progresses. Where all the folks you hear today on the panel, we're working really closely together because this is exciting stuff. We want it to be a success. So thank you so much, Sarah.
Thank you.
All right, now I'm going to go over to Sarah to talk about the loan forgiveness program. Okay, so you ready, Sarah?
Sure.
All right. So how's this loan repayment program going to support providers working in rural or high need areas? Let's go right to our problem spot.
Absolutely, and thank you. And Kelly, you already framed it so well, and you kind of shared how 40% of North Carolinians live in a mental health professional shortage area, and 97 of our counties are rural counties. So this is not a small problem that we have. And the loan repayment program is designed to help change that by directly addressing some of the retention barriers that can be broken by assisting folks with loan repayment. It offers up to $50,000 per applicant, like per provider, student loan repayment for licensed providers. And they have to commit to working for 3 years in these designated areas, which are designated rural and then underserved. And this isn't just financial relief, it's really an incentive for stability and for people to have an opportunity to stay in the areas where they grew up, where their heart is, where they want to do this work. And by easing the debt burden, we make it more realistic for counselors, social workers, addiction specialists, and psychologists to live and work in the communities that need them most.
Thanks for that, Sarah. I don't know about others, but I was honestly ruminating. When you started talking, I started ruminating about when I came out of social work school and I got a job in community mental health. And I had the most horrible, I should tell you my salary, y'all, you'll be horrified. Although I don't know how much better they are today. And somehow I was going to repay my school loans and have a house. I couldn't have a house. I rented. And, it was really rough on top of the really rough job. And I didn't have these type of loan repayment opportunities. And I think they're pretty rare in North Carolina. They're really hard to find. I think this is kind of huge. So I digress. So when's it going to launch? And what's the timeline for application for providers?
Absolutely. So we are targeting early 2026 launch. Might be a little earlier, but that's what we're targeting. So January, we will be opening up our first application cycle. And the application process will be fully online. So this will allow providers to confirm their eligibility, their licensure and loan documentation, and track their application status. So really, we just launched a website where there's more information. There is frequently asked questions, and that will be the website which will also have the application link and all the required documentations listed on that. And I think we just put in the chat the website that we just launched. So we're really looking forward to it, and there will also be a contact information there too, even before the application launch. If you have any specific questions, please reach out so we can individually respond to those questions as well.
And Sarah, I know you gave the amount, it could be up to $50,000. Did you say what the commitment was to
3 years commitment?
3 years commitment, okay.
3-year commitment. It could be the same site that meets that eligibility criteria for that underserved area, but it could be multiple sites too. So we will work with folks, because some people might be working in two different sites in the same area, but we will be working with all of that.
And there's probably, Sarah, there's some sort of threshold around the whatever service you provide, you take X percentage of public funds, meaning Medicaid or state fund, right? Okay. But it won't be 100%, understanding that many providers take other insurance as well, and that's going to be okay.
Absolutely. So we do require these sites and agencies to have at least 40% of their patient population to be Medicaid.
Okay. And for many folks, right, that is especially because some of the services we provide, no other insurer covers, right? So if you're out there providing ACT or CST or in-home, I mean, you are going to be just fine. So, okay, super, super exciting. Thank you for posting the website, everyone. I'm sorry, everyone. It was one of those moments where I've seen the beautiful website. So sometimes I lose track of like, okay, I've seen it, but is it live? So it is live. So awesome.
It is.
Thank you for that. And Sarah, did I have one more for you? Yeah, like bring it all together. Like, how does this loan forgiveness connect to everything else that we talked about today?
Absolutely. And I know Sarah talked about that. Kelly, you also shared that in your intro too, that the loan repayment program is one piece, right, of the coordinated strategy that we are talking about here today. It's about retention, while other initiatives focus on entry and advancement. The CUPE expansion initiative, it expands, as Betsy and Melissa talked about, who can enter the field by recognizing associate level human services degrees. And then you bring in the social work leadership program, which builds the next generation of public service social workers through education, partnership, across 25 plus colleges and university. And then we bring in the loan repayment program, which complements both, ensuring that once providers are licensed and serving in the field, they have the financial stability to stay in North Carolina communities. So together, these efforts build a true pipeline from entry to leadership to retention. So we are not just filling vacancies, but we are really sustaining a long-term health workforce across all 100 counties.
Yes. Thank you for that, Sarah and Melissa and Betsy. One of the things that I don't believe I said in my slides, but you've certainly reinforced it. I think access is to me, and I think these initiatives show, first and foremost, it's about quality. Then it's about quantity. Like we're not just trying to flood the workforce with people who are underqualified and undertrained. We're trying to make sure, again, that we're leaning into our educational experts, because that's who you guys are, not us, right? We're telling you our need. You're saying, we got this. We can help people learn practical skills, leadership skills, clinical skills, whatever kind of skills that would actually well prepare them. Then we're going to support them. Then we're going to reward them for their service with loan forgiveness, because we're really trying to increase the quality of care that's provided in the public system. That's just as, if not more important than having enough bodies for services. We need high quality services. So I'm really grateful, super grateful to the Social Work Consortium, UNC, to the North Carolina Community College system, just for being a partner with us. So before I hand it off to Dina, any last words from any of you? I just want to open it. If you do, you do. If you don't, you don't.
I just want to share, please frequent our website. There are many different projects that are in flux. So as new information comes, new links will be added, new information will be added. So please bookmark this page.
Yes.
And I just want to say one more thing. In addition to
Yes.
all the work the faculty have done, the legislature gave the community college system $55 million for expansion and startup for healthcare programs, which was more, for all of our health programs. But we have invested $750,000 into our behavioral workforce partnership consortium, and that is part of that has created this partnership with DHHS, and just has a lot of creativity and a lot of really good use of these funds to advance some of the classes and all the things within the behavioral health space. So we're appreciative of that, as well as that money that came in, and that our faculty got together and said, hey, we can all work and to create some better resources and offerings for our students. So really, really wanted to lift that up as well.
Mm-hmm. Awesome. Thank you. Thanks again to our panel. We're really, really, really proud of these partnerships and grateful for them. So you will see QR codes, website links to all three of these workforce initiatives. So please check them out, and know that, again, through Hot Topics, we'll do another webinar if we need to. We'll be sharing additional implementation plans and information on all of these. So thank you so much for joining us today. Over to you, Dina.
Thanks, Kelly. If we did not get an opportunity to answer your question during the webinar, questions and feedback are welcome at bhidd.helpcenter@dhhs.nc.gov. The recording and presentation slides for today's event will be posted on our Community Engagement and Training webpage. For more information and resources, stay connected with DMH CDS US by attending our monthly side-by-side webinars and joining our mailing list. The links are included in the chat. There will be a brief survey following today's webinar, and we would appreciate your time completing it. Our next side-by-side webinar is scheduled for Monday, December 1st from 2 to 3 o'clock. We hope to see you then. This concludes our webinar for today. Thank you for attending.